you'd like to make a start, please.
Brilliant. Thank you very much for joining us today. We've got one of our colleagues, Hany Elbardesy, who is a arthroplasty fellow at Ashford in Kent, and he's going to talk a bit about healthcare management and service improvement scenarios. Now, I know it sounds like a very complicated title and very dry. It is on the syllabus, and they do turn up, so do pay attention. I've also been asked by FRCS just to draw your attention to a few courses coming up. So we've got the Principles course coming up on the 23rd and 24th of April, and also later on in the year. We've got our Viva clinical cases coming up as well as basic science cases, all sort of key sort of topics that come up in the basic science Viva part of the Viva section. So please, if you're interested, to join and sign up. They're very helpful. People have found them very useful. All right. Without further ado, I'll leave you to Hany.
Thank you, Dave. Well, good evening, everyone. So this is lecture tonight about the healthcare management and service development scenarios for FRCS exam. So why the management role for doctors is important. So like a few studies, one of the most common or study about that by McKinsey in London School of Economics. They stated that if the doctors or clinician participation in the management role, that's scored about 50% higher than other hospitals. So that's why like dealing with these scenarios are very important. Understanding the healthcare management for doctors is very, very important. And that's why it turned up recently in the last few exams, in the last few years. Another thing why it's important, because if you don't develop yourself, you will not adaptable to survive. So the species that survives was more ability to adapt to change, according to Darwin. So now, how? So the first question from the examiner may ask you, okay, so you have a problem in your institution. Like, I'll give an example, like the waiting time in the any department is long, or the waiting list for your elective cases is long. So how to look at how you can address that? So that is like the same thing. This is, we like want you to know how you can do any change in your organization. So this is 3 techniques. Most of the candidates say, okay, so I'll do an audit, like a funnel plot, but these are 5 minutes questions to answer. So you have to have a lot of knowledge, and you have to be prepared to ask these questions very well. So we'll go step by step. So there is a techniques and the steps after that. So number 1, we have to know which part in the hospital, what's the problem, and according to that, you need to make change. So the 3 techniques, which are like work discovery. So the work discovery, instead of assuming that you know how work is designed, examine it firsthand as actually conducted. Then determine how to turn the inevitable surprises to uncover into assist. So instead of waiting for complications, drawback, negative feedback from the patient, try to discover that yourself. So the first technique is work discovery. And what's your tools here? Audits, funnel plot curve, which is performance analysis. The second technique, which is called better practice. So better practice, simply, you are adopting other organization best practice technique. So then screen the way work gets done in your organization through this best practice in order to generate new ideas. This is not audits, so it's a different technique. So the aim to use the best practice to generate the better practice. Okay, now you can generate a new ideas. So you can do a meeting with the team to generate a new ideas to convert the better practice to the best practice. The third technique, which is test training. Okay, so you have to test like what you can implement in your organizations, what the change you can do, what's the ideas, and try to do test training, train the people to do that and see how it goes. So the three techniques again, so work discovery, and this is the only one that includes audits, funnel plot curve. But there is another two techniques everyone missed in the exam, which are better practices and test training. So please memorize these three techniques in your mind, and this is your introduction to answer any questions in the healthcare management. So these three techniques are fixed to answer any questions. Because when you want to do any change, there is driving forces by yourself, and there is training. So we have to convince the people that you need to change. And now we'll go back here, how to discover that by all these things. So work discovery, better practices, and test training. That is the people will know why you need to change. Because sometimes you are the only one, you see something wrong, and the other, they don't agree with you. So we have to show to them there is a problem somewhere, there is a delay somewhere, there is a waste of resources somewhere. And there is a technique. This is the second thing I want you to memorize and to answer in the exam in any healthcare scenario questions. So there is a 8-stage mentioned by Cotter. We can like divide it into 4 stages, which initiate a change, which by like establishing the sense of urgency. So you have to raise that you have a problem in the institution. So that, for an example, the waiting time for elective cases 1 year. That's a sense of urgency. The theater time, like you're doing less number of cases every day, that is a waste of resources. So that is one thing, that's a sense of urgency. The waiting time in the ENI department, so is long, that is a sense of urgency. So it is the first step, remember that, the first step in any change process is you have to raise a sense of urgency to the people. Then gather with the team and plan for a change. Then implement your change and then make it all over the institution. So initiate, plan, implement, institutionalize. So that is the 4 steps, okay? So we'll go now to some examples or some scenarios about the healthcare management. So he will ask, the examiner will ask you for an example. Okay, the waiting time in the emergency department is long. So some people wait for 36 hours to being seen by a doctor in the emergency department. So how you can deal with that? So, okay. Now you have to give some idea. Okay, so we'll go back to the quarter 8 stage, initiate, plan, implement, institutionalize, and then you have to give idea. One of this idea, acute surgical assessment unit. Why it's important? Because you will bypass the waiting time. So there's a certain people with a certain criteria will bypass the waiting time in the emergency department and will go to a dedicated unit. So that is the reason why we have acute surgical assessment unit. So it's a unit would allow surgical patients attending the emergency department in this institution to bypass traditional assessment pathway and proceed directly through the dedicated unit. That is the sense of urgency. So your target, this will facilitate more efficient evaluation of the patient and expedite operative intervention where it's required. So which type of patient? So it's not a critical patient, but acute. So you have a selection for the patient, and you will give the ED team or the triage nurse a criteria for certain patient that will be bypass the waiting time and will go straight away to the ASAU. And there is a nurses, dedicated nurse in that unit, will review the patient, will check that all the criteria have been applied, that's correct, then will inform the surgical team, and after that, the surgical team will deal with these patients. So now you deal with the problem, which is a waiting time in the emergency department, and most of the hospital has ASAU, but we don't know why. That is the reason some hospital has this unit. Another thing, so virtual fracture clinic, why it's important? It's the same thing. The problem or the sense of urgency. You have the waiting time for the people to be seen by the doctors in the fracture clinic, sometimes 3 to 4 weeks, sometimes 7 weeks in the busy hospital. So at that stage, like the fracture will be healed. There is no point at that stage if there's any complication to be seen by the doctor. So we need to filter the numbers of the people to like make a quick decision for a certain kind of people, and to make the number for the patient to be seen by the doctors face to face in the fracture clinic will be like no waiting time, like 1 or 2 weeks, and will be efficient. That increase the efficiency of treatment for the patient. So the virtual fracture clinic are aiming to improve the efficiency and standardize patient care and reduce clinic appointment for injuries that can be managed conservatively. So that is the sense of urgency, because you have about in the UK the 2 million fractures every year. 30% of the people attending the emergency department are related to musculoskeletal and soft tissue injuries. So if you have a plan for this patient will go to the virtual fracture clinic, that will be reviewed by the consultant next day, and he will decide which patient will be face-to-face and which patient will go to the physiotherapy and which patient can be discharged without any treatment. So we'll give a quick decision. That's to make the service very efficient. So that is outcome. So the waiting time will be reduced, and about 36%, or more than 1/3 of the patient will be discharged. There is no need to attend to the clinic, and that will be more cost effective. And so you save the time and money of the NHS or the institution, and you save the time and money for the patient as well. So there's no need for the patient to travel to the hospital to wait for 2 or 3 hours to be seen by the doctors, and that wasn't necessary. Another scenario here, which is a major trauma center, which is a big, is a big topic actually, and you can be asked about the major trauma center in general, or you can pick a subheading of major trauma center, like a trauma network or trauma coordinator, or all these things could be separately being asked. How the questions could be asked here. So number one, may ask you how to develop the major trauma center, or how to transform or to convert your hospital to a major trauma center. So first of all, you have to understand why the major trauma center is important. Because before initiating this idea, or this for the UK to have a major trauma centers, they found that the people younger than 45 years old with a trauma, the mortality is high without a major trauma center. Because the patient will go to the primary hospital, then might be transferred to another hospital due to lack of facilities, and that will increase the mortality rate and the morbidity as well. So that is why we need a major trauma center. So how we can achieve that? How we can initiate or develop a major trauma center? So it's the 4 main things. So the first things is the safety and quality. So that is your answer. You will start your answering about the major trauma center about these four like main things. Number one, safety and equality. Number two, monitoring the outcomes. Number three, rule in the trauma network. Four, arrangements for the patients. Very, very important to memorize these things. Now we'll go one by one. So the safety and equality for the major trauma center. So you have a trauma team 24/7, and then you have a trauma team lead must be in the place, and this trauma lead or the trauma also they have experience in the trauma. They will not like transfer any patient, so they can deal with any kind of trauma. So you have to have all subspecialties in trauma. You can deal with the pelvis and acetabular fracture. You can deal with the spine fractures. You can deal with open fractures. Okay, so you have a consultant appropriately trained to management any major trauma, and plus that you need a trauma lead, okay, which is a background in orthopedic general surgery, emergency medicine. That's very important. Second thing, you need a specialist service, and the specialist service, and there is a core service, the core which is orthopedics, general surgery, anesthesia, emergency, and then ITU. That is in every hospital, but you need a specialist service as well. So you need a neurosurgery, spinal cord surgery, vascular, cardiothoracic, plastic, max fax, ENT, and diagnostic and intervention radiology. So you have to have that, and just to say core service and specialist service. B, with the second thing is the trauma coordinator, which might come separately. What is the trauma coordinator? What is the role of the trauma coordinator service? So the trauma coordinator, it's a nurse, trauma coordinator nurse, maybe more than one, have 24 hours across 7 days, Monday to Sunday, even the weekend, to ensure the patient focus and coordinate trauma service from the admission to discharge, even after the discharge for the rehab. So she or he will be responsible for any trauma patients from the admission until the post-discharge as well. Another thing, you need to have a nursing service and staff, and not only like a general nurses. You have to have sub-specialist nurses, well-trained. So you have to send them for courses, and you have these nurses should be well-trained, have enough experience to work in the major trauma center. And this is, you have to have appropriate nursing skill mix, like advanced nurse practitioner, clinical nurse specialist in place to provide a care to all stages in the patient journey, from the admission even after to the rehab. Then health and social care profession service and staff. You have to have a range of relevant and appropriately trained health and social care professional in the major trauma center as well. So Monday to Sunday, so 24/7, not 24/7, but every day. And you have to have all the diagnostic and the lab service. So you have to have like a CT, MRI scan, intervention radiology is very important, ultrasound, everything. And the rehab, so the other things, you have to have a rehab service and the rehab staff, which is very important. There is a part of the like a trauma network, that's part of the trauma network director of rehab, which should be appointed with the responsibility of the rehab service within the network. So from the admission of the patient till the discharge, there is a trauma network director for the rehab. He's responsible for the plan for the discharge for all patients, all the trauma patients. And you have to have a major trauma center rehab lead appointed to lead the rehab care for the trauma patient. And you have also rehab coordinators with him to arrange to find the places for the patient in the rehab center for how many days, how many weeks after the discharge, that or necessary. You also need a specialist nurse, rehab assistants, physiotherapist, dietitian, occupational therapist, speech and language therapist, medical school social worker, and psychologist, neuropsychologist. All these have to be like you have to have all these things. Then facilities and infrastructure. So you have all the required personnel, but you need equipment and infrastructure. Number one, the facility. So in the emergency department, you are a major trauma center. So you, in the building itself, you have a place to deliver safe and effective service in a timely manner, including resuscitation, resus room, trauma bays, which are adjacent to the hybrid suite, allow immediate access to the CT scan. That is an example. CT scan intervention radiology. And you have like parking bay available for different number of ambulance service. Sometimes you might need a helicopter, like a park for that, or space for that as well, for effective transfer of patients from the remote areas. And also you have like plus in the emergency department resus room, the parking base proximities to the sit down area to allow the crew to park for the period longer than those required for simply offload patients. That's why you need like a dedicated places for that. You have to mention that that is part of the infrastructure or the building for the major trauma center. So also it's important to monitor the outcomes. So you have to measure trauma audit, and you have to submit all the data to the major trauma audit. And you have to like incentivize that or optimize the quality of care of the MTC or the major trauma audit with the best practice. That is what we discussed in the initial slides. Another things, you have to take like annual extensive peer-reviewed process as part of the operation and development of the trauma network or trauma system. So that's how to monitor the outcomes. You have to do like major trauma audit. Number 3, which is the rule of the trauma network. Those is like save time. So it's bypass, like instead of like transferring patient to the primary hospital. No, you have if the paramedics have a certain criteria for a certain patients, you will not transfer this patient to the primary hospital. Will go straight away to the major trauma center. That will save time and might save life as well. And that's why the mortality rate is lower after initiating the major trauma centers. So the major trauma network and that requires appropriate ways of working in line with the best practice with regard like trauma bypass, like and appropriate hospital access for trauma patients or orthopedic trauma bypass, and you have the coordinations of the rehab service after the admission. So that is part of the rule of the trauma network as well. Number 4, as we discussed before, we have to make arrangements for the patient after discharge, which is a part of the rehab and the trauma coordinator and trauma networks. Both 3 are important in that. You have to make arrangements for the patient. So this one will go to the nursing home, this one will go to the rehab center, this one will go home, but will be dedicated nurse who look after him every second day or something like that. So you have to have a plan from like after the surgery or since the admission. What is the plan for discharge for each patient to save the patient, to save beds for the new patients? Thank you very much.
If you'd like to go through the poll, please, Hany.
Okay, so I think 8 out of 13 got the wrong answer, unfortunately. So yes, it's audit funnel plot curve. So the number 2. So work discovery is audit funnel plot. Screens the way it get done in your organization through the best practice. It's called better practice technique. So the right answer is number 2. Okay, we'll go for the second questions, please, Hannah.
Yeah, you should, if you just, I'm sorry, Hany, if you just scroll down a bit, you should be able to see the answer, that 54%.
Oh, okay, sorry.
Yeah, sorry.
So the second, okay.
Yeah.
So yeah, the number 4 is the right answer. So yeah, it's about 50-50. Yeah. And number 3, yeah, number 2 is the right answer. That's right. So yeah, 62% answer the right answer. So it's number 2, 30%. Yeah.
Okay, fab. Shall we move on to questions now?
Yeah.
Abdullah or David, do you want to go through the questions?